Hi everyone and welcome back to SGR. This is Teacher Grace, and for this lesson we're going to look at reading part A. We're going to do some summarization of the four texts, text A, B, C, and D, and we'll teach you some strategies on how you can answer question 1 up to question 20. Let's get things started. So in part A, the very first thing that you need to look at are actually these four texts. Once you understand what these four texts are all about, we can then look at the 20 questions pertaining to these texts. The problem that I have, and I'm going to be honest, is that some of you will come to us and tell us that you actually start with these 20 questions first without looking at the four texts. And this becomes an issue, okay? The reason I was given by our students is that they fear that 15 minutes in part A is just too short. They don't really have the time to look at the four texts. What they want to do is to go straight into the questions, and then from the questions, go and find them in the text. But in doing so, it's going to take you time because you don't really understand what the texts are talking about. The second problem I have in that strategy is that you could get lost, okay? Meaning you're going to go to A, oh, it's not there. I'm going to go to B, it's not there. So you're going from one text to the next, okay? And that kind of takes time. So it's making you answer the questions longer. The next reason is that by doing so, because you're in a panic mode now, you're doing your time pressure. And when you're pressurized for time, we tend to make more mistakes, okay? And that's something that we don't want a lot of you to experience during the exam. So what we actually suggest or to recommend is that we start understanding these four texts first. By spending a little bit of time, I would suggest maybe 30 seconds per text, or altogether about 2 minutes. That is a very good time to get the gist or the main idea of what the text is talking about. And by doing that, you are answering the questions much faster because you do know where the question is. You tend not to get lost, okay? And you can scan the text much quicker for the answers. Secondly, it also improves accuracy, okay? So let's start summarizing. We're going to teach you some strategies on how to do this so that you're not spending too long in terms of reading and understanding the text. So when you are summarizing, it's important that you understand what kind of text is being presented to you. In this example, we've got a very short text, and you can see that every paragraph, they're quite short, okay, starts with a word written in bold, okay? We always say these are words that are written in a special way. So our eyes tend to focus on these words. So we will do exactly the same. And what you can see in here is I've hidden some details from you, because you don't really need to read them, okay? Number one, you can use your grammar knowledge, okay, to give you an idea what the text is all about. Secondly, you can also use your medical knowledge, okay? Let me show you how. The very first one is on fractures and talks about fracture being a buckle or a break in the bone. That kind of tells you, okay, this line, even though I've hidden some information, tend to give me what is fracture. It's giving me the meaning of fracture, the description of a fracture, okay? Now, the two, dislocation and sprain, is also signposted in the same way. They use the word is in here, so dislocation is, sprain is, and typically that's your grammar clue that the next words being given to you will be descriptions or additional information. So we know for a fact now that text A is a very simple short text telling us the meaning and the definition of what is a fracture, what is a dislocation, and what is a sprain. The other thing that you will notice in here is that we do have what we call the bullet points. So in here, so we've got the close and the compound in there. And these bullet points are basically the areas we're in. It kind of tells you these are examples of the topic above, or sometimes they are what we call types, categories, or classifications. What you need to remember is that when a text is giving you descriptions, meaning and definition, majority of the times you will also see the different types in that information being given. Sometimes you might also see some causes or triggers, okay? So it's going to tell you what causes a fracture, what causes a dislocation, and what can cause a sprain. So these are the type of information typically found within a meaning and definition text. Now let's move on to text B. Now text B again, presentation-wise, looks different. This is much longer, okay? Look at that one compared to text A earlier. And what you will find in here is now we have a heading at the top, okay? Unlike earlier, we don't have a heading. We've just got words written in a special way. But this one, much nicer. We've got a heading at the top, and you will notice that we've got 3 subheadings, underneath. Now, the 3 subheadings, we've got in the middle is your clinical assessment. So when we're assessing a patient, that means we are asking questions such as medical history. We could also be doing some observations and physical examinations. So this is the time that your medical knowledge is helping you understand what's written in here. That's why I said you don't need to read everything. You can make predictions based on grammar, which is what we use in text A, and then based on your medical knowledge, which we are using on text B. Now, the other 2 subheadings, we've got immediate management at the top and management at the bottom. Now, management is treatment. It means you are treating a patient, you are managing a patient. But they're split into 2 because one is immediate, meaning the priority, the very first thing that you will do, or in some cases, we call this emergency. Okay? That means that the management here at the bottom is different from the management here at the top, because the one underneath are basically other things that you can do once you've done this. So it seems to be chronological, meaning these are the first things that you need to do, and once you've done them, you can do the rest of the treatment underneath. Okay, so 3 information, long text, shared within bullet points. So we can definitely say that text B is very quickly a text that gives us the assessment information and the management information of simple fracture of limbs. Now let's look at text C. Again, very different presentation. So in this time, we're being shown a table. When you have a table, that means the heading at the top typically talks about the topic inside the table. So in here, we've only got one topic that is just about morphine, nothing else. So by the title alone, we can say, well, it's a protocol, which means something that we need to follow. It's a procedure. And that procedure involves therapy, which is treatment or management. But the treatment and management this time, unlike earlier, which is kind of generic, a lot of different treatments, this one is very specific to drugs. And that drug is, again, very specific to morphine. The other thing that you will notice by the way that they design text C is that you have a very short paragraph at the top and some information here at the bottom. Now, they're quite short, so what I would normally suggest is that you do read them. And what you can see here is that authorized, and we've got the different people or healthcare practitioners that will be administering the morphine. So that we can definitely then say that text C is all about treatment using morphine and then who administers them. And then at the bottom, we've got procedures to follow. How do I know these are procedures? Again, we're going to use our grammar knowledge. What I've highlighted here is that I can see the word use, provide, and give. They are verbs. Okay, verbs are action words. They tell us what we're supposed to do. We need to use this, we need to provide this, and we need to give this, which means this is a procedure or something that we need to follow or to do. Okay, so always remember that whenever you've got verbs, those are instructions, things that you need to do. So we now go into the last text. This is text D. Again, nice and simple. We've got a heading at the top. So by the word technique, we again know that this is a procedure. And very similar to text C, we can see words that are using verbs. Okay, so the verbs again, action words, it's telling us what to do. These are instructions. We need to measure, we need to wrap, we need to immerse, etc. Okay, so when there are instructions, always think this is a process, a procedure, a technique, things to follow, or what to do or how to do it. Okay, and then the other thing that I want you to notice are these numbers. So we call them numbers lists. Numbers list basically tells you this is chronological. What that means is that you need to do number 1 first. So that will be your step 1. This is your step 2, step 3, so on and so forth. What it also means is that I'm not allowed to do number 4 without doing 1, 2, and 3 first. So by knowing how they are designed, okay, we know this is chronological, it will help you answer some of these questions later on much better, okay? I'm going to show you how once a question comes in later on. So when you understand the text D is all about how to apply a plaster box lab, so a step-by-step procedure, then it makes things easier later on when answering the questions. So everything that we've learned so far about what is text A, text B, text C, and text D will now help us answer the matching questions. In the matching questions, you've got your summary on the right side. So we've got text A reminding you that this is all about meaning and definition. Text B being assessment and management. Text C being treatment by morphine. And text D on how to apply plaster box lab. When you have a very good idea or you remember what each text is talking about, it makes you answer the questions so much quicker. Okay. Now, typically what I give students in this part when we're practicing is about 1 minute to 1.5 minutes. And that's why you're seeing the timer up there, now. So within this time, within 1 minute to 1.5 minutes, I do expect that you can finish the matching questions. And how is it that you say, that's quite short, 1 minute, 1.5 minutes? Because by knowing all of this information, you should be able to understand and very quickly answer the questions 1 to 7 using keywords. Okay, and that's the one that we're going to practice now. So for question number 1, our keyword is delivering pain relief. Now, pain relief is synonymous to morphine, okay? And the word delivering means you are treating the patient. So definitely a treatment by morphine. So the answer here is letter C. For number 2, our keyword is splinting. So when you're splinting a fractured limb, that's what we do when we are applying a plaster box lab. So 1 and 2 should be nice and quick. By the time we go into 3, we've got the word assessing, and that is synonymous to the word assessment in text B. Remember, assessment was the one in the middle. And then for number 4, it said that terms used to describe. So meaning the words, when you say terms, they're the words that are describing the different types of fracture. Well, yeah, those words or those descriptions can be found in text A. For number 5, again, another easy one. So I hope you got this correctly. We've got the word analgesia, okay, which means it's a medication. Then the word administering, which means you're giving it, you're treating the patient with medication. And that medication is morphine. So this is text C. For number 6, we're looking, we're checking. So looking and checking means we are doing observation. And observation is something that we do when we are assessing the patient. So the answer is text B. For number 7, we're being asked, where can we find the information that tells us how fractures can be caused? Well, as I mentioned earlier, when you've got something, a text that gives you the meaning and definition of the information or the topic that's being told, many times it does include causes, okay? So that typically brings us to text A. So I hope that you didn't just finish this quickly, 1 minute to 1.5 minutes, but also that you are able to answer these questions more accurately. Okay, so now that we've finished with matching, let's move on to the rest of the questions. Now, the rest of the questions can be either a short answer question or a sentence completion. These two interchange. Sometimes the middle questions can be short answer, which is exactly what we have in here. But sometimes it will be sentence completion first, followed by short answer questions. So don't think that, they're kind of fixed. The only fixed questions here will be matching because they're always the first set. So let's have a look at some of the short answer questions. Now, in here, before you actually go and very quickly scan, we need to make sure we don't get lost. Okay, so in order to not to get lost, we're going to do exactly the same as what we've done earlier in matching. We're going to try and find which text can answer these questions first. Now, the question says, what should be used to elevate a patient's fractured leg? Well, when we are elevating a leg, we don't do that in meaning and definition, okay? We tend not to do that in treatment and morphine. So when we elevate the leg, we're actually doing it during the assessment of the patient, because sometimes when you observe, you have to lift, okay? And when we're treating a patient, okay, we can elevate the leg as well, because it might say, okay, can you please raise my leg? Or maybe it's coming from the doctor to say that, the leg must be raised, etc. So that's something that you could definitely do in text B. It's something that's possible to be done in text D as well, because when you apply a plaster back slab, there might be an instance wherein you need to elevate a leg. But between these two, as I've mentioned earlier, text B is very generic treatment. Okay, when you say generic, the treatment can be given with medication, possibly with a procedure. Perhaps there will be descriptions on surgery as well. They're very generic. We don't know what kind of treatment is being given. But text D is very specific. The treatment here is the procedure plaster back slab. When we look at our question, the question is quite generic. Just elevate a patient's fractured leg. It didn't mention the word plaster back slab or splinting in here. So I would then say that B is where we need to look. Okay? So now we are in text B. Now remember that text B is split into 3 parts. The first part is your immediate management, the second part is your clinical assessment, and the last part is your management. Well, again, when you elevate a fractured leg, most likely it's part of your treatment, okay? Very rarely do we elevate when we're simply observing. So I would then say that in order to read faster and look for the answer much quicker, we're going to use our medical knowledge to say elevating a leg is part of management. So we look under the to management area. We then look for the keyword elevate, which we found in here. Okay, now elevating here involves 2 types of limb. Okay, one is the arm, okay? And then the other one is the leg. So you need to go back to your question because the question specifically said leg only, not the arm. So what we're going to choose here is this part. So in order to elevate the leg, we need a pillow. So in here, OET will accept either the answer pillow or the answer a pillow. Okay, hopefully that's something that you managed to get as well. So let's move on to question number 9. So this one is pretty special to me because a lot of you tend to get confused when you have questions pertaining to dose and dosages. Okay, so let's have a look. So the question is asking for the maximum dose of morphine. Just from that alone, we know we're going to go to text C, treatment by morphine. So now that we are on C, we're looking for the dosage maximum. And then the other clue we were given is that it needs to be IM route of administration. So that means we focus on the IM only. We're not going to look on the IV part, only focus there. And we need to find the dose. And the dose is inside the recommended dosage area. So we focus our eyes in here, okay? Now, within this part, we found two information. The first one gives us the full dosage, okay? The full dosage is 0.1 to 0.2 milligram per kilogram. The second information is this one, and it said a maximum overall dose of 10 milligrams, okay? So which means that you're going to look at or check the weight of your patient first, and based on that weight, we're going to then administer 0.1 to 0.2 milligrams, okay? But once you've given the dosage several times, we need to stop once we've given a total of 10 milligrams. That's what this dosage recommendation means. So again, before you give your answer, I want you to read your question again and make sure that you are understanding it correctly, because a lot of the questions in OET tend to be specific. So this question is looking for the maximum dose of morphine per kilo. Okay, so the first one is per kilogram, but the second information is not per kilogram. So even though it's got the word maximum there, that is not the maximum per kilogram. This is maximum per patient. So that means if we're looking for the maximum per kilo, then the answer will be 0.2 milligrams. We do not add /kg or per kilogram in here simply because your question already includes the words per kilo. Okay, so in reading, I would always suggest you do not duplicate words that are already given within the question area. So hopefully that really makes you understand more about how to choose answers based on minimum, maximum, as well as, between dose and dosage. So let's look at question number 10. So in here, we're being asked which parts of a limb may need extra padding. Well, again, medical knowledge. If you're giving extra padding to the patient, okay, that's something you typically do in a plaster box lab when you're splinting. So we know we're going to go into text T. By the time we go into text T, we need to find the words extra padding. And we found it in here. Now again, now that we found the answer, go back to the question, read it again, make sure you understand what you're looking for. In here, we're being asked for the part of the limb, okay? So which part? So that means the body part. So when we look in here, we can see that that body part is the bony prominences, okay? Nice and easy, okay? I hope everyone found that one. For question number 11, we're being asked, what should we use to treat a patient who suffers from respiratory depression. So again, treatment information. So treatment information, unfortunately, can be found in three areas, okay? The generic treatment, which is in text B, a very specific treatment via medication in text C, and another treatment using plaster backslab. Now, between these three, if your patient has respiratory depression, we don't actually do the plaster backslab area. We tend to give a generic treatment or the morphine treatment. So I would suggest you look into B and C first. So unfortunately, unless you remember the information given earlier in the text, you might have to look at two. So we're going to look at text B. We're also going to look at text C. So by the time we go into B, because this is treatment, we again do not look in the assessment area. We focus our eyes on the management area only. Now, we look in there, we look in the management at the bottom, and unfortunately, we didn't find any information with regard to respiratory depression. So that means we know the answer is hiding here in text C. So again, focus on that word, respiratory depression, and look for it within the text. By that time, we found it down at the bottom. So in here, because it's very specific to an instruction, what should be used, then I'm looking in here. Remember, this is just to inform us who's administering the morphine. This is all about morphine. Nothing there was mentioned about morphine. So I know because this is an instruction, it will be any of these three. So then I look in here and I find respiratory depression, and it said give naloxone. So naloxone is the answer. Let's move on to question number 12. Very, very nice. We see the keyword plaster backslab. You won't get lost this time. We go into text D, okay? So when we get into text D, all you need to do again is very much into choosing another keyword. So another keyword here is covering a freshly applied plaster backslab. This is when that chronological knowledge will help you, okay? Because freshly applied means you finish what you needed to do already. The patient already has a plaster backslab. So that cannot be on number one because here you're just measuring, you're just wrapping. Here you're still measuring. Here you're immersing the plaster. So here you're checking for jewelry. So the very first time that you actually see the patient being applied, plaster backslab is really from number 6, okay? Because when you say molding the slab, that means you're applying it already. So we've seen that one, but this one is only the start of application of the slab. So that means our answer could only be on 7 and 8 because this one said freshly applied, okay? Okay, so we then look at number 7 and we can see that in here it says extra padding can be placed over bony prominences. So it looks like at this point we're still applying something. So that cannot be, the answer that we're looking for. So we'll then look at question number 8 and it said wrap crepe bandage firmly around the plaster backslab. There you are. Because the question said covering a freshly applied plaster backslab. So the covering here is the crepe bandage because it says wrap and then you've got the plaster backslab here. And that's precisely why we cannot choose number 7 because we're not really covering the plaster backslab. We're covering the bony prominences in here, okay? So the answer will be crepe bandage for that one. Now, for question number 13, we're looking for the analgesic. That should be given to a patient who is allergic to morphine. Okay, hold on. This is when you might get lost because you see the word analgesic, you see the word morphine. So immediately you're thinking, I'm going to go to text C. I'm gonna do the text that talks about treatment by morphine, but look at the question. The question said the patient is allergic to morphine. So which means that C might not be where you will find it, okay? So the other treatment, okay, that gives you other options is actually on the B part, okay, the generic one. So this is more likely where we will find the answer because the patient is allergic to morphine. So we cannot use C because T is treatment by morphine and the patient is allergic. So we go into text B. So again, text B, we're not going to look into the assessment area. Focus your eyes on the management area. Look for the analgesic and look for the word allergic. And you will find it here on the fourth bullet point. It said administer analgesia. So there's your analgesic there. And if not allergic to it, give morphine. Okay. If allergic to morphine, use fentanyl. So we then choose fentanyl as our answer. Very, very confusing question. So I do hope you know the trick, okay, in order to find the right text. Because if you get lost and you go to text C first, it's gonna cost you time, okay? So we've now moved on to question number 14, okay, another short answer question. So typically short answer may be another 6, 7, 8 questions. Okay. So I'm guessing because we're now on 14, this might be the last one. Okay. So question said, what condition might a patient have if severe pain persists after splinting, elevation, and repeated analgesia? Okay. I'm gonna get confused in here again because I see the word splinting. I know that's going to be on plaster backslab. I see the word elevation, and based on our answer earlier, we know we elevate the leg in text B, okay, the generic treatment. And then we've got the word analgesia, which I know is in text C, in morphine. So again, you might panic and thinking, oh, I don't know where it is. Is it going to be on B? Is it going to be on C? Is it going to be on D? So again, use and analyze the question. This question contains all of these three. The morphine doesn't talk about plaster backslab, so it's out. In the same way, plaster backslab doesn't talk about morphine, so it's out. So again, we go into text B, the generic one only. So by the time we go into text B, again, no assessment here, straight into the management, look for splinting elevation and analgesia. And we found it on bullet point number 5. It says, consider compartment syndrome where pain is severe and unrelieved by splinting. So there's your splinting part. Elevation, there's your elevation part. And 2 doses of analgesia, which gets you the third one. So the correct answer in here is compartment syndrome. Now we finished the short answer. We're going to move on to the sentence completion questions. Now, the sentence completion questions, to be honest with you, can be answered exactly the same way as we've done short answer. We're going to do the matching first. Try and understand where can we go to find the text. The only problem you have now, which is different from short answer earlier, is that in a short answer question, there really isn't any grammar check, okay, or very little grammar check is being done there because it's sort of ask a question, you give the answer. So even if you only answered one word, pillow, but the text said a pillow, you can give either of those answers, and those 2 answers can be, accepted. But in a sentence completion question, because that answer is part of that sentence, we call this fill in the blanks, okay? That blank area is part of that sentence, which means there will be grammar check in here. So that means if the grammar is only looking for a singular word, and you give up the plural word, so limb to limbs, your answer will be wrong. Okay? So grammar check, very important here in sentence completion. So let's look at number 15. It said, falling on an outstretched hand is a typical cause of a blank of the elbow. Okay. Cause is the main keyword in here. So that means if it's cause, we're going to find it under text A because as I remember, if you remember what I said earlier, majority of the meaning in the definition text, will include or sometimes include causes and triggers as well as types, classifications, or criteria. And we know for a fact, if you remember, it's a very short text, easy to remember, that there are two types in here under the fracture. So there might be cause information as well. So we go into text A. By the time you go into text A, you're going to look at additional keyword this time, looking at the word outstretched hand and the word elbow. Once you find them in the text, okay, then you focus your eyes in here. So we're looking for the cause of a blank of the elbow, meaning something happened to the elbow. And it says elbow dislocation after falling on an outstretched hand. There you are. What happened to the elbow is it got dislocated. So dislocation will be the answer in there. What I will always say is always copy the answer exactly the way that you see it, okay? So this word is dislocation with the word elbow in the front, and because elbow is already given there, we're going to remove it, okay? We've got the grammar check in here. Is singular, so do not add an S in here, okay? Many times I would suggest, if you see it as a singular, write it as a singular, okay? Always copy the way that you see it in the text. For question number 16, again, the word elevated, we've been asked this a few times, so we know that we're gonna go into text B. So here this time, we're looking for the upper limb, and this is where we found the elevation earlier. And earlier we found the leg and the arm, and we know that upper limb means the arm area, okay? So that means we're gonna go into the arm information. So the answer in here is sling, okay? So your text said sling, but we're gonna remove that because that is already there. So sling is the only answer accepted. Question number 17, nice and easy. It used the word plaster back slab. So we're going to go into text D. So when we read the question again, it's something that the patient shouldn't be wearing. And the only information there about what we wear is actually on number 5, which means that the answer in here is jewelry. Okay, now again, be careful with the spelling because I know some spellings are not written like this for jewelry, okay? So yes, they will be allowed whether you spell them the British way or the American way, but in order for you to be sure that your answer will be accepted, again, I'm going to remind you, copy exactly the way that you see it. Okay, make sure you're not making spelling mistakes so that you always get a point for that answer. Let's go into question number 18, checking to see. So that means we are making an assessment, and assessment is text B. So unlike what we've been doing in text B earlier, we're always looking into the management part. We're in here, we're only checking. So we're not really managing, okay? That means this falls under the assessment area. So we're going to look into the assessment. We're going to use two keywords, the word swollen and the word increasing in size, okay? So we've got swollen in here and increasing in size in here. And that's something that you will find here. So swollen is available there. And then the word increasing in size, the phrase, is actually the same as the phrase getting bigger. So if it's getting bigger, that means the size is increasing. So the answer in here is throbbing. Okay, so check to see whether the swollen limbs are throbbing or increasing in size. Question 19, again, back to plaster back slab, so back to text D. So here we're looking for the layer of blank closest to the skin. Well, closest to the skin, which means that they've wrapped something already, and or did they not wrap anything yet? So if it's closest to the skin, that means it's only the start of it. Okay, so because we're doing plaster back slab, if you use your medical knowledge, you know that there's several layers in it. And we're looking for the layer that is closest to the skin, which means it's going to be at the start of the procedure. So we're going to look at question number 1, or um, information number 1 in here, okay? So it says measure a length of non-compression cotton stockinette from halfway up the middle finger to just below the elbow. Okay, so at the moment we're just measuring. We're not putting anything yet on the skin. So we read number 2. It said, wrap the cotton padding over the top of the full length of the stockinette. Oh, okay. So that means if you're wrapping cotton padding over the stockinette, then that means the stockinette was the very first thing that we actually put closest to the skin. So the answer in here is stockinette, okay? Which is here on number 2. But in number 1, it gave us a longer answer. So even if you answered stockinette or cotton stockinette or non-compression cotton stockinette, all these 3 answers will be acceptable. We're now on to our last question. So the last question is looking for dosages of pain reliefs. Okay, dosage, we know will be in the treatment by drugs. And then pain relief, that will be your morphine. So we're going to take C, okay? Then it's giving us instructions again, saying the patient's age blank and over should not be given the higher dosage of pain relief. Well, okay, that's an instruction. So I'm not going to look at the top area. I'm not going to look at the table. I'm actually going to look at the 3 information down at the bottom. And in the bottom area, I only found one with age, and that is greater than or equal to 70 years. Okay, so which means that the answer in here will only be 70. Why? Because your question already has the word and over. So the only answer acceptable here is just the age 70, or you can add the age plus the word years. But again, because the years is already here, sometimes adding them in here can be very risky. So I normally would only suggest you go just for the numbers and do not give them words already available in the question. Okay, so I hope you've learned so much in terms of how to quickly read the 4 texts and basically not get lost and be able to scan the text to find your answer as quickly as you can. So if you want more tutorials like this, please do scan our QR code. Come and join us for our online study groups as we help you understand OET reading better.